Thanks for staying with us. Continuing with Gauteng Health System Focus, the Acting Director General in Gauteng Premier's office, Thabo Masebe, joins us now. Thank you so much for your time, Mr. Masebe. I want us to start with a very concerning development with regards to Charlotte Maxeke Hospital. We do understand that the Department of Infrastructure in the province has been asked to no longer be involved in the refurbishment of that hospital. I want you to explain to us why that's the case.
Well, there are a number of reasons that we considered. One of the problems was that the timelines that were proposed by the Department of Infrastructure were too long. We would have completed the project by 2027. And we were obviously very concerned about that because we wanted the hospital to return to full service as soon as possible. And there was also a dispute between the Department of Infrastructure and the Department of Health, where the Department of Health was not agreeing to the scope of work and, of course, the timelines, as I've indicated. And critically, they also could not agree on the budget. The Department of Health felt that the budget proposed by the Department of Infrastructure was too much. And that they believe the project could have been done for much less than what the infrastructure department was proposing. So because of that dispute, and it took long to try and resolve, we felt that it would be better to remove the Department of Infrastructure from this project so that a new project team could take over and complete this project in a shorter period and at cost. So once we decided that, we then spoke to the National Department of Health, and they agreed to take over the project, and they brought in the DBSA as the new implementing agent.
Okay. Mr. Masebe, there's a very in-depth article that's been written by the Daily Maverick's Mark Haywood, and he speaks about how there are people within the Department of Infrastructure in the province that have been suspended because of allegations of corruption and maladministration. Are you aware of this, and is this part of the reason why the Department of Infrastructure in the province is not going to be part in the refurbishment of this province?
Yes, I'm aware of this matter. There are 9 officials in total, 6 of them from the Department of Infrastructure and 3 from the Department of Health. All of them were involved in the Charlotte Maxeke project, but their suspension is in relation to the refurbishment of the Anglo Gold Ashanti Hospital, where the SIU investigated and found that there were gross irregularities in the awarding of contracts for that project. And based on that, we placed them under suspension, and they are currently, or charges are being prepared, where they will face disciplinary proceedings.
And how far is that process going to, how long is that process going to take?
Well, I don't know. It is a process that is presided over by an independent presiding officer. So from the side of government, we hope that it should take, it should be done as quickly as possible. But as I said, we have to, in terms of the labor law, appoint an independent presiding officer to preside over the case. The charges are being finalized, and over the next few days, the process is expected to start.
Are you looking at suspending any other individuals, not necessarily with regards to the Anglo Gold Ashanti project, but any other concerning projects, because we do know that the healthcare system in this province is in shambles?
Well, the Anglo Gold Ashanti project is just one of a few projects that were being investigated by the SIU. As soon as the SIU gives us more reports and more referrals, if there are more people to be suspended and placed under disciplinary, we will take that action. But currently we are dealing with these 9 officials, as I said, 6 of them from infrastructure and 3 from the Department of Health.
You know, it's very concerning because I would have hoped that the Premier's office would investigate and identify concerning tenders, concerning projects in our healthcare. For example, Kopanong Hospital, we were there yesterday after we read the article on Daily Maverick, where we're actually showing our viewers these visuals right now. We do understand that ICU wards were expected to be built there to assist with COVID-19, field hospitals. I want to know what the budget for that was and why this project has not been fulfilled, because quite frankly, Mr. Masebe, it's completely unacceptable for something like this to be happening, given what has happened in this province when it comes to healthcare.
Yes, indeed, it is unacceptable that you have a project like this that is incomplete. There were several problems with the service providers that were appointed by the Department of Infrastructure, and this is one of the projects that is currently being investigated by the SIU. So we await the report of that investigation.
How much money are we talking about?
Well, I don't have the full amount here, but obviously the whole project for the infrastructure that were linked to the response to COVID-19 goes into billions of rands. I'm talking about there are about 5 hospitals or 5 projects that were implemented, and those include the Kopanong Hospital.
But Mr. Masebe, do you find this acceptable that over R1 billion has been said to be irregularly spent because it was, either a tender went wrong or you were unsatisfied with the service provider? How is that acceptable, given that you have Charlotte Maxeke up in flames? That's only going to be finished in 2023, at the end of 2023. You have healthcare workers who are basically crying and saying they are not coping with the state. Kopanong Hospital, let's just leave these white elephants, is in a complete state, and people are not coping. They don't want to go there because they think they're going to die.
Yeah, no, it's not acceptable at all. No one can accept that. These infrastructure projects were initiated in order to create additional capacity. And now the fact that those were not completed is very worrying to us, very concerning.
It's worrying to you, but what are you doing about it, Mr. Masebe? It's worrying to everybody. It's taxpayers' money. It's the most vulnerable people in our society that need health care. What are you doing about it?
I've just said, Heidi, that there are 9 officials who are placed under suspension for their involvement in all these projects. The other projects are still being investigated by the SIU, and I think if we can exercise a little bit of patience and wait for that report so that we can take action based on the evidence that the SIU will provide, we will be able to do that. So currently we are dealing with a matter relating to the Anglo Gold Ashanti Hospital, and as soon as we receive further reports and referrals, we will take appropriate action.
You say you just hope people could be a bit more patient, and I don't think people who are in desperate need of health care can be any more patient. There's just been one scandal after another, but hopefully this will provide some kind of clarity and put some pressure on the Gauteng government. Thank you so much for your time. That was Thabo Masebe, who's the Director General in Gauteng Premier's office.